My name is Ann Kelly, and I'm the mother of 3 children, 2 of which have recently been diagnosed with a mental health condition, bipolar 1, with anxiety. The journey of my 2 has been different, but interestingly enough, they've both been diagnosed with the same disorder. My daughter's journey was one where she was a happy, healthy, stable child who, through her adolescence, had many friends, very athletic, great student, and we proceeded with her going into high school thinking all would be well. She hit high school and the pressures of a high-achieving high school. She started to show signs of anxiety, but we just passed that off as that's a natural part of being in a high-achieving school with lots of social pressures, etc. And she managed to get through her high school years without any indication of any mental health condition. We sent her off to OSU and the honors program, pre-med track, and academically she continued to be a high achiever. But the social aspects of a Big Ten university led her to feeling heavy anxiety. So she came home for her summer break, and it was clear that the anxiety had gotten the best of her. And as the weeks proceeded, she then started showing signs of depression. So I made the assumption that it was just a situational depression. We went to our primary care practitioner, and they prescribed an antidepressant. And unfortunately, the diagnosis was wrong, and that antidepressant threw her into an extreme mania. So we had to hospitalize her, and in the care of the Lindner Center, they were able to identify that she was bipolar 1 with anxiety, and that an antidepressant was not the right medical choice. We have now been able to provide her with the correct medical care, and she is back to school and succeeding as a junior at Ohio State, and coincidentally, she's changed her major to neuroscience. My son, on the other hand, as a child was diagnosed with ADD and then depression, and so he had been treated for many years with a psychologist, and his events that led up to his acute episode were we missed the signs of his lack of sleep, his nutritional choices, his very overt change in social behavior, testing the limits with drugs and alcohol, not being able to attend school on a regular basis, and we just felt as though he was being that typical high school junior who wasn't really behaving, and we should have known that those were signs of a more deep-seated mental health issue. When his crisis hit, we were brought to Children's Hospital, and luckily for him, based on our experience with our daughter, he was quickly diagnosed with the same disorder and effectively treated with the same medicine, and he is now back to school within 5 months of the event, and we're pleased to say that he seems to be stable and functioning at a normal level. We have learned as a family that a mental health condition is one that can be effectively treated. And medication is not the silver bullet. There's no single solution for the condition. And accepting that it is a lifelong condition that can be effectively treated and managed, but requires the understanding by the child that they do have this condition, and it's hard work. They have to eat properly, they have to get plenty of sleep, and they have to be physically active. And for teens, that's a challenge. As a mother, a person who always thinks she can fix things, it was a revelation that this is a condition. There is no cure, but we can effectively manage the condition with the help of professionals. They can help the family come to a healthy and happy life and productive existence. One of the most surprising aspects of our journey was the signs and symptoms of mental health conditions are very subtle. And raising teenagers, they present themselves with a variety of pushing the envelope, testing, behaving in ways that may not be exactly what you would want, but you just expect that they're going through a phase. And in retrospect, I wish I had taken more time to discuss with both my children as well as the professionals what constituted signs and symptoms of mental health as opposed to just being a teenager. Another surprising aspect of our journey was the chaos that the family feels when an event in a mental health situation occurs, in that they take on personality and behavioral traits in that acute phase that are really shocking. And to understand and have the confidence that they're going to come out the other end and you'll get your child back is something that all parents should hold on to. The third surprise was that we didn't, the medical community that we had built around us had made some mistakes, and it was really incumbent on us as a family to better articulate what the family history was, what the genetic component that we didn't at the time fully understand is so strong. And so for parents with any immediate family health conditions, mental health conditions, I strongly encourage parents to reach out to the true professionals in mental health, unlike where we initially went with our daughter to a primary care practitioner. The last surprising aspect of our journey was the sense of there is a beginning, a middle, and an end. And parents need to know that if you bring the right resources to bear, you will get your child back. And the chaos that you feel in the midst of those acute events have to be taken in context and a perspective. And luckily for my son, who came on the heels of my daughter's experience, we are much better prepared and able to cope with the initial chaos as well as proceed through the treatment. And now, within 5 months of his event, he's back on track and back to school. It's really important for the child to accept and understand their condition and understand that medication is part of the solution, and that side effects are going to occur, but the need for the medication is critical. And they also have to accept that they're going to have to put in some hard work in terms of counseling and managing their lifestyle so that they continue on with healthy life choices such as good nutrition, sleep, and exercise. And for teens, that can be a challenge. Some concluding thoughts on what it's like to go through a journey with your children when they're diagnosed with a mental health condition. Acceptance is the biggest concept that I've had to come to terms with, and that is what your hopes and dreams are for your children, what you initially conceived, may not be what you initially thought. And the hard work that they have to put in and the suffering that they have had to endure is difficult. But what I'd like to leave people with is a sense of this is also a gift, in that my children are much more sensitive and emotionally attuned to others. And I truly believe that they will be better in their relationships in life because of that. And the other gift is my children have now found a community like 1 in 5 where they can be advocates and be leaders in advancing the understanding of mental health and start the conversation and be part of something that's much bigger than themselves. One last thought around the community of mental health and the importance of the work of 1 in 5 to advance the education and understanding of mental health conditions and identification of those early. The earlier the better, and bring the right resources into the school systems in order to give our children the hand they need in order to have healthy, happy, and successful lives.